Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and now we are ready to begin a very new chapter, that is the chapter of CVS. And there the first topic that it is the topic of vasculitis. That is the topic of vasculitis, right? So what is vasculitis? Vasculitis is nothing but the inflammation and the necrosis of the blood vessel wall. What happens is, if there are certain external factors that is affecting your blood vessels very much, as a result of which what will happen, your blood vessels will start to swell up, your blood vessels will start showing the inflammation. Just like if you are so angry on someone and that person just keeps on pushing your limits, right? He keeps on saying you certain things. So what will happen? You will also become inflamed, right? And one day will burst. Similarly, your blood vessels, if they are not treated well, one day they will not burst, but they will give you a heart attack. Next, what are the causes? In the causes you have is the first one is the ischemia. See, what is ischemia? Ischemia means the loss of blood supply. If there is a loss of blood supply, what will happen? The blood vessels anyway is now getting necrosed, right? Second one is the infarction, and the third one is the aneurysm, right? Third one is the aneurysm. Aneurysm is nothing but the bulging of blood vessels, the bulging of blood vessels, right? Next, it can involve any organ, because it does not believe in discrimination. It involves each and everything, right? What is the journal pathology that I want you all to tell? First thing, it is the immune complex mediated, ANCA associated, because we will learn about the C ANCA and the P ANCA. Third one is the anti-endothelial cell antibodies are involved, and there is direct infection of the blood vessels which is there. Now, let's see a broad classification. Broadly, you have the division of vessels into three categories: large, medium, and small. In the large one, you have a large name, like the giant cell and the 𝗲𝗵𝗵𝗵𝗺. Giant, the name only says giant. Giant means large. Okay, so it is related to the large vessels. Medium vessels. In the medium vessels, you have the polyarteritis nodosa and the Kawasaki disease. You have the polyarteritis nodosa and the Kawasaki disease. So remember the mnemonic of PK. Have you watched that movie PK? If not, then after seeing this mnemonic, please watch the movie PK. It's a very good movie, although I'm not doing any promotion. If you want to watch, you can. Either it's your choice completely. So in the medium vessels, you have the polyarteritis nodosa and the Kawasaki disease Now, next that you have is the small vessel. In the small vessel, you have two types: the immune complex mediated and the 𝗲𝗲𝗹𝗵𝗺. Now, let's see the small vessel vasculitis in details. You have the immune complex mediated and the 𝗲𝗲𝗹𝗵𝗺. In the immune complex, you have the SLE that we have read in the immunity chapter. Then you have the hemorrhage purpura that we will read over here. HSP we will read over here. In the 𝗲𝗲𝗹𝗵𝗺, you have the venules. Then you have the microscopic polyangiitis and the 𝗲𝗲𝗹𝗵𝗺, right? So these are the 𝗲𝗲𝗹𝗵𝗺. Let's just see the classification once more. You have the large vessels, medium vessels, small vessels. In large vessels, all the large name Takayasu and the giant. Giant means large. Medium vessel, PK movie. Small vessels, you have the immune complex mediated and the 𝗲𝗲𝗹𝗵𝗺. Now, in the immune, you have the SLE and the hemorrhage purpura. And in the 𝗲𝗲𝗹𝗵𝗺, you have the venules, 𝗲𝗲𝗹 and the microscopic polyangiitis. Now, let's see about the pathogenesis in journal. First thing, you have the immune complex deposition. Immune complex depositions are seen in which of the conditions? So, they are seen in the SLE, the polyarteritis nodosa and the HSP, hemorrhage purpura. There, what happens is there is a complement activation, as a result of which there is neutrophils recruitment. Second, I have told you we will be discussing about the ANCA also. So you have two types, P ANCA and the C ANCA. In the P ANCA, you have the 𝗲𝗲𝗹𝗵𝗺, and in the C ANCA, you have the venous granulomatosis. See, if you are having difficulty in remembering now, remember the CP. CP is in Delhi. Also tell me what was the prior name of CP. So CP. And here you can remember the World Cup. World Cup. That is Wegener's is for C and CP. Structures is for ANCA. Okay. Next you have the autoantibodies to endothelial cells that is seen in the Kawasaki disease, and Kawasaki disease is very common in children, right? Next we will study about them in details. See, first one is the giant cell, that is involves the temporal artery, and temporal arteries are found over here. So see this figure. In this figure, what you are able to see? You are able to see that the temporal arteries are so prominent. And if there is an elder in your house and he or she is so angry, so you are able to see that their arteries are also very prominent, right? So that is the giant cell. They involve the large vessels because they are the large vessel vasculitis, so they involve the large vessels. They are mainly affected in the elderlies who are more than 50 years, and women's more than men's, because women's are always more aggressive than men's, right? The pathology that you have here are the giant cells are involved. Then you have the fragments of internal elastic lamina. See, I'll show you the figure. See this figure. You are able to see what? You are able to see some brown deposits. I guess it's not that clear. Wait, I'll draw. You are able to see this brown deposit. That is the internal elastic lamina. Okay. And these are nothing but your giant cells granuloma. Right. So what are the clinical features you have? The person will have a very severe headache. Jaw claudication will be there, and there will be visual loss. See, if there will be a case, they will always mention about the jaw claudication because it is a very important thing that they need to mention in that question to make you come to that diagnosis that it is a diagnosis of giant cell arteritis. Okay. Next you have is the investigations. In the investigations, what you will be able to see? You will be able to see the ESR will be raised, and biopsy is the gold standard that you have to do. Treatment is high dose steroids we will give to them. Next you have is the Takayasu arteritis. Takayasu arteritis is a pulseless disease. It is present in young women who are less than 40 years of age, and they are the large vessel vasculitis, involve the aortic arch and the branches. Pathology, you will be able to see the granulomatous thickening. See, here you will be able to see some thickening of the vessels. See this one, how clean it is, right? And see here how much deposit. I'll draw a figure for you. I guess it's not that clear. This is a blood vessel, right? This is a clean blood vessel. This is a normal one. What will happen here? Here there will be so much of deposits that will be there. I made a donut, I guess. There will be deposits. There will be so many deposits that will be there in the blood vessels, right? What is the clinical features that we are able to see? We are able to see that the pulse is absent in the upper limb. And you have to tell me what are the points in upper limb where we are able to take the pulse. First one is the radial pulse. Then you have in the cubital fossa. Which pulse we are able to take in the cubital fossa, that you have to tell me, right? Then you will be having the visual defect. Then you will be having the claudication. And for the treatment, what you will give? You will give the steroids and the immunosuppressant. See, if nothing, you don't know nothing about what will be the treatment that we will be giving. So just remember, in each and every case, write one thing, that is steroids. Okay. Next you have is the polyarteritis nodosa. See, not in every case I am telling you about the vasculitis portion, or else you will say ma'am has told that to write the steroids in each and every treatment. So you are writing steroids for each and every, even for diarrhea you are giving steroids. For the polyarteritis nodosa, it is a medium vessels are involved. It is associated with the HBV virus. And you are able to see a string of beads. See this figure over here. You are able to appreciate a string of beads. A string of beads like pattern is there, right? The organs that are involved are kidney, heart, liver and lungs are spared. So you have to be very, very careful in the things that are spared, because there are probable chances that they will make this question as a MCQ, because it is an exception, right? And you don't want to lose your marks in your MCQs as well in your university exams, right? So that's the thing. In the clinical, what you will have the abdominal pain, you will have the melena and the hypertensions. And what is the criteria of hypertension we are following right now? Tell me. Investigations, you will be able to see the P ANCA is negative. Treatment, see, I told you, steroids. First thing you will write. Second thing is the 𝗖𝗵𝗵𝗴𝗺, if you are able to remember that. Next, very favorite disease of children. You have a Kawasaki disease, okay? Kawasaki disease is equals to children. So it is seen in the children who are less than 5 years of age. And it has anti-endothelial antibodies. See, this tongue, strawberry tongue. What we call it as? A strawberry tongue. So from now onwards, when you are eating strawberry, this small kid, the Kawasaki kid, should come to your mind while eating the strawberry, okay? And you should remember all the things that I have discussed with you in this Kawasaki. So for the Kawasaki, the clinical features can be remembered by the mnemonic of crash and burn. What is crash? It involves the conjunctivitis, it has rash, it has adenopathy, that is the cervical adenopathy, involvement of strawberry tongue, and it has hand and feet erythema. Burn means there will be fever of more than or equal to 5 days, right? So these are basically the clinical features that this disease will have. Now, what are the complications? The complications, it can be coronary artery aneurysm can be there, right? And the treatment that we give is a very, very important treatment. We give IVIG. We give IVIG plus aspirin, right? So this was all about the Kawasaki. Next, moving on to we have is the microscopic polyangiitis. Microscopic polyangiitis involves the small vessels, and it also has the P ANCA antibodies and involves the kidney, lungs and the skin. It involves the kidney, lungs and the skin. And the treatment for this that we gave is the steroids and the 𝗖𝗵𝗵𝗴𝗺. Steroid is everywhere in the vasculitis. So steroid we have to give, right? Next, but you know what? We have discussed the conditions in where we have not given the steroids, and that is the condition of Kawasaki. Have we given the steroids? Why? Because in this condition, the children are mainly involved and we avoid steroids in children, right? Next you have is the Wegener's granulomatosis, and what mnemonic I have told you to remember? The mnemonic of World Cup. The mnemonic of World Cup, right? So it is a small vessel is involved, necrotizing granulomatous vasculitis. In this disease, the small vessels are involved and you have the C ANCA antibodies that are there. So you have a very, very good triad in this disease. What is the triad you have? You have the involvement of upper airway. That is, you have either sinusitis or the nasal ulcers that are there. In the lungs, you will be having the nodules and the cavitation. In the kidneys, you will be having the RPG, and we will discuss about this when we are discussing about the kidneys, because we have a whole separate chapter for the kidney. Okay, there we will be discussing all the conditions in details, right? So this is basically the triad. It involves the upper airway, it involves the kidney, and it involves the lung. So if there is a clinical scenario in which this triad is given, because there are possible chances that they can give you a clinical scenario and they can mention these three things, these triad, they can mention in further diagnosis to make the diagnosis of Wegener's, right? The marker that you have, I have already told you, World Cup, C ANCA, and the treatment is steroids and the 𝗖𝗵𝗵𝗴𝗺 that we give. See, this is a C ANCA. This is a C ANCA which you are able to see under the microscope. Next you have is the 𝗲𝗵𝗵𝗺. Next you have is the 𝗲𝗵𝗵𝗺. It is a small vessel is involved and the eosinophil rich granules are involved. Clinical features are, it is mainly seen in the patient of asthma because it is associated with allergies. And which type of immunoglobulin you are able to see in the patient of asthma, and also tell me which type of hypersensitivity reaction you are able to see in the patient of asthma. Okay, next, and mast cells are for histamine. Then you have the allergic rhinitis and the eosinophils. You have the involvement of P ANCA. We have told the mnemonic of CP cannot place, right? That's in Delhi. Involvement of lung, heart and skin. For the treatment, our evergreen steroid we will give, right? Next you are able to see about the Hinnon-Schonlein purpura HSP. This is also very most common in children. It is most common than Kawasaki. See, in India, the cases of Kawasaki are very more as compared to that of HSP, but HSP is very common. Okay, it is the most common vasculitis in children. The clinical features is, first one is hematuria. Hematuria means the color of the urine will turn red. Then you will have the child will have the abdominal pain, arthalgia and the palpable purpura. See here in this figure, you are able to see in the skin how red things that have come, right? So all this legs of this person become red. Some rashes will come there, that are nothing but your purpuras that will come to the child, right? Treatment is steroids. Here we have given steroids, right? Next you have the Bourgeois disease, not your burger disease. Okay, you have a disease called as the burger disease. Okay, it's not your burger disease, it's Bourgeois disease, right? And also not that burger that you eat, right? So this is basically associated with smoking. So if a person is a very chronic smoker, he or she is most likely to develop this disease. What happens is, in this disease there will be, if I tell you about the histology, there will be inflammation plus clots and thrombus formation. See this figure over here, you are able to see some of the thrombus formation. Here you are able to see the thrombus formation that is there. So what happens now if that person is a very chronic smoker, right? Like he cannot leave cigarette for a day also. What will happen after some times when that person will start developing this disease, and after walking for even a 1 meter, after walking a 1 meter of distance also, that person will start feeling pain in his legs, right? So for that, he needs to take some rest. That is nothing but the intermediate claudication, right? So he or she needs to take certain amount of rest, and after taking the rest, then they will get up again and then walk, right? If you are attending your medicine postings now, just do the CVS examination properly and just try to see this claudication part. I guess you will be able to see this claudication in your surgery posting, not in the medicine. You will be able to see this claudication one in your surgery posting, right? So what is the treatment? The ultimate treatment is cessation of smoking. If that person stops smoking, then this disease will also go away, right? So the treatment is cessation of smoking. I hope I made this clear. This was all about this chapter. Let's just recap what we have learned about this chapter. In this chapter, we have seen vasculitis is nothing but the inflammation of the blood vessels. Journal pathologies we have seen, this ANCA-associated anti-endothelial cells that are there, direct infections are there. Classification, we have the large vessels, medium and the small. In large vessel you have the giant cell, Takayasu. Medium you have the PK. Small cells, immune complex, 𝗲𝗵 immune complex you have SLE and Hinnon-Schonlein. In the 𝗲𝗵 you have the Wegener's and the microscopic and the Churg-Strauss. Then in the giant cell, temporal arteritis, large vessels, remember this figure. Jaw claudication is very important in this. ESR will be increased. In the Takayasu, it is a pulseless disease seen in the young females. Pathology, remember, clinical, absent pulse will be there in the upper limb, that you have to tell me what are the pulses of the upper limb that you have. Next, you have the polyarteritis nodosa. In this, you have the necrotizing vessels. Organ which is spared in this, lungs are spared. Clinical, you have the abdominal pain, melena, and the hypertension. Kawasaki is a disease in children of less than 5 years of age. You will be having the strawberry tongue. Mnemonic of crash and burn will be there. Then you have the Wegener's World Cup, small vessels necrotizing a triad of what? Upper airways are involved, kidneys are involved, lungs are involved. 𝗲𝗲𝗹𝗵𝗺, CP. Small vessels, eosinophils, rich granulomas, 𝗵𝗵 is associated, lungs, heart, and skins are associated. Hinnon-Schönlein purpura, most common vasculitis in children. Clinical features are hematuria, abdominal pain, arthalgia, and palpable purpura. Buerger's disease associated with smoking, histology, inflammation will be there. Treatment, cessation of smoking. Although smoking is not at all recommended and you should not do smoking on a regular basis. So this was all about the chapter. Now I will be giving you certain questions. So the first question that I will be giving you is, tell me the most common vasculitis in children. Is it the Kawasaki? Is it the Hinnon-Schönlein purpura? Or is it the Wegener's? Or is it the giant cell? So you know how you have to do this question. They are asking most common in children's, right? So the very first thing that you have to rule out is rule out Wegener's, rule out giant cells, because they are not seen in children's. You have two options. Kawasaki is seen in children of less than 5 years. Is it the most common? No. I have read that most common is this, HSP. But the cases of Kawasaki are more as compared to HSP. Okay. So I guess we are good to go. One more thing. 𝗵𝗵 is associated with. Is it the giant cell? Is it the Wegener's? Is it the 𝗲𝗲𝗹𝗵𝗺? Ruling out giant cell. No, it cannot be the option. Then Wegener's or 𝗲𝗲𝗹𝗵𝗺, either two. But I have read a mnemonic of World Cup. That is, Wegener's is 𝗵𝗵. And 𝗲𝗲𝗹𝗵𝗺 is 𝗵𝗵𝗺. CP. Delhi. Okay, so I hope I made this chapter very clear for you all. If you have any doubt, you are feel free to reach me and feel free to DM me, right? Thank you so much.